Let's talk now how a patient can actually use this medication based on medical cannabis, because the traditional image which we can have from media or from books is that we see the cannabis flowers or the oils. So it's the most current existing on several markets, Europeans or Americans formats, the flowers to the vaporization or to smoke under cannabis cigarettes, we can say, or the oil containing cannabis extract. But we know that the innovation also within your company, one of your companies, are undergoing the new formats, implementing new formats who are more pharmaceutical formats of medicine. And here in Europe, we are seeing now new dosages forms being adopted. For example, some pharmacies in Poland, in Germany, they are doing under magister formulation extracts, and then they are formulating the ointments or suppositories which can be used in the specific group of patients. Could you please elaborate here more which kind of innovation they are now currently developed to avoid the situation that, for example, patients of palliative care are smoking the cigarette with cannabis, or eventually even using the vaporization of flowers, which is difficult. Like the person with Parkinson, they're not able to grind the medical cannabis flowers and then to use this complex vaporization system. So which kind of innovation do we have now ongoing for the pharmaceutical companies in this field?
Sure. So there are many innovations, both coming from the pharmaceutical industry and the medical device industry that supports the pharmaceutical industry, as well as consumer products developed mostly through the recreational market. So the innovation is, there's no lack of innovation. But we have to understand that because these receptors of the endocannabinoid system exist in all parts of the body and all cells in the body, the effect will be different depending on how we deliver it. In fact, I didn't mention this, but one of the things that Meshulam talked about, and he actually had a student that had a PhD on this, was the effect of cannabis on the microbiome. That it turns out that the cannabis prevents the bacteria of creating colonies, basically having an effect on the quorum sensing. So it affects our body, it affects our microbiome, it has an effect on any part of our body, and the way we deliver it has an effect both on our on how we interact with it. So, for example, inhaling, you see the effect very rapidly, but the duration is very short. So it's obviously, if someone has a need for an acute relief of a symptom, be it a neuropathic pain or migraine or some other condition, then taking a vape or other form of inhalation makes sense. But if someone has, let's say, an inflammatory disease that requires basically continuous use 24/7, then you're going to want to give something that will have an effect of much more duration, such as an oral delivery. The problem with oral delivery is that the absorption is not consistent between individuals. It could be as low as 7% or as much as 35% in different people. The enzymes that break up the cannabinoids are different in different people, so the duration effect will be different. The metabolism in the liver will be different in different people, so we're going to get inconsistent effects in oral ingestion. But on the other hand, the liver converts the THC to 11-deoxy-THC, which has a much more potent and longer duration effect. So you actually get, even in oral delivery, a better effect for more duration. And then obviously there's the sublingual and buccal delivery, which is kind of a middle ground between oral and inhalation. Not to mention other approaches such as dermal delivery and intranasal delivery, and there are all kinds of these different approaches that are being developed.
So you mentioned here like how much pharmacokinetic or even pharmacodynamic must to be studied. So you mentioned inhalation, oral use, and also sublingual use. So accordingly to these three different way of drug delivery, then we have also various galenic forms of the finished product. So the development now, obviously, from the big pharmaceutical companies are stagnant because of the regulators. We know that, for example, in Europe, we have still access with only magister formulation approach. And the magister formulation, it's limited on the technologies. So the pharmacist can develop some basic formats. But to be back to new trends of innovation in what we have, for example, in pharmaceutical development. So what do you think will be now ongoing, like inhalation, like nanoemulsion, something to improve absorption or bioavailability of these very lipophilic and long molecules, which are difficult to absorb by the body?
Sure. So I think we're going to see different formulations. You mentioned nanoemulsions, which is basically increasing the bioavailability of the cannabinoids. People are now talking about loading exosomes with cannabinoids, which is, by the way, the body it is in the body in the form of exosomes. So we're going to see different formulations, different devices, chronic implants, and things like that. That's obviously going to be developments in the future. But I just want to mention that one of the problems we see with cannabis is that a lot of people start using cannabis even before they go to the doctor, and because they know that right now the regulations basically are saying that you only use cannabis as the last resort as opposed to the first resort. So it becomes very difficult to do a clinical trial with de novo patients that have never used cannabis. And so that's one of the challenges we have, is that some people know that it has an effect on them. They just want the drug. They want the doctor to prescribe the drug, and they're not going to really wait to try different drugs that may have less effect on them before they start using cannabis.
So the advice you would say, because we are like, we can say that it's almost personalized medicine. So from the product perspective, you know that pharmacists play the key role here, because he can, based on the prescription of the doctor, provide, for example, suppository for the palliative care, or the liquid solution for the pediatrics, or the people with the limited swallowing during some cancer, for example, treatments. And as a medical doctor, so you know that what is the key to implement these therapies in practice. I mean, titration is very important. We know that there is no one scheme, no one model that we can use, something which one size fits all, but more personalized medicine approach. So how you explain here how we start medical cannabis prescription, how we can promote this beneficial use of cannabis for patients?
So first of all, I would start with CBD products before I would increase the dose of the THC, because CBD is actually on all the immune cells in the body, and it basically stabilizes the immune response. And a lot of the chronic diseases that we see in patients are related, obviously, to some instability of the immune system, not only autoimmune diseases, but many of the chronic ailments that we see. So I would start with CBD, and then when we go with THC, I would start low and go slow, because the problem with THC, people don't talk about this much, but when you go to very high doses of THC, and we saw that in recreational cases where there was no supervision of doctors, there's a phenomena that is chronic vomiting. Very violent vomiting that can only be stopped by stopping cannabis, cold turkey, and stopping cannabis. So it's not something that you'll see early. You'll see it maybe 10 years after using very high doses of cannabis, but it's something that doctor's not going to see. He's going to prescribe a high dose of, let's say, THC, and then 10 years later, the patient may have, if they're still alive, hopefully, they may have some problems that they don't know what the cause of it. It could be because of the cannabis.